Welcome back, our viewers, to the physiotherapy segments. Of course, I'm host Abdul Latif Lanizi, but as always, this time I'm different. I'm wearing a suit. I'm trying to be a little bit more casual, out of the gym style. So now having with me our Dr. Jawad Abul Hassan as a physiotherapist. He's given us all of the information that you want to know in regards of your body. A lot of people goes to the gym. A lot of people work out almost every day, but not knowing which is the most dangerous thing to you while we are doing it, and sometimes we are doing a lot of things wrong. So with that, we're starting a special segment with our doctor. He's going to give us all of the information that we want and need, and of course with a remarkable smile that you are seeing on him. So first things first, welcome doctor. I'm so glad to start the new segment with you, and I'm so happy actually.
My pleasure, Abdul Latif, and thanks for the invitation, and I hope we can make a good interview.
Interviews, yes.
That can help the viewers, and we make sure they learn a few things that can help them in their life, for sure.
Inshallah. It's not actually a few things, because they're going to learn a lot from, because sitting with the doctor before we start the interview, before we start the segment, having that you have this remarkable experience. I'm so glad for it. Doctor, let's start the first conversation, shall we?
Sure, we shall.
So, doctor, in regards for the first question that I want to ask you is actually some of the common injuries, but you can tell us about it, which is the rotator cuff injuries. Some of the rotator cuff tears, there are some of it comes up with different names. Can you explain it for us?
Sure. Rotator cuff injury is a type of injury that happens in the shoulder joint. It's a common injury, mainly for people who are using their shoulder repetitively.
Yes.
For example, handball players, basketball players, those for the athlete population, and also the normal recreational exercisers who play overhead game and do some workout at the gym. So it's a common injury. It involves the muscles around the joint. The underlying cause is some muscles of the rotator cuff got hurt.
Is it serious, doctor? I'm sorry to cut you. Is it serious?
No, it is serious if you don't treat it, because when you get a rotator cuff injury, you'll face two things.
Yes.
A limited range of motion, which can limit your movement around your shoulder.
Not too much freedom. We don't like that.
Yeah, of course. We like freedom.
We like freedom. We like to move a lot.
As always.
Yeah.
And the second thing is it's a painful joint, especially at night. So when they sleep, they don't sleep well. The pain will be aggravated. So those two features are common with rotator cuff injuries.
Actually a nightmare.
Yeah, because the last thing you want is somebody can't sleep.
Can't sleep.
Really,
oh my God.
That's
especially
the
when you
number
have
one
injury or something. Yeah.
Yeah, number one risk factor for
exactly.
a disastrous day.
Yeah, really, because if you couldn't sleep, you won't start your day in a good way. So, doctor, a lot of people have this shoulder pain. Can you tell us the symptoms that we have on some of the rotator cuff injuries? So, let's say if some of our viewers have it, they can go and they can get diagnosed and maybe treat it.
Yeah, commonly they come with a painful shoulder. So the patient will come to you and say, I have a pain in that area, I have pain around the shoulder, I have pain while I lift my hand. So that's a number one common symptom of rotator cuff. Also, specifically if the patient tell you that I can't comb my hair, so overhead activities.
Yeah.
And if I can't scratch my back, this is also two most common features of rotator cuff. So you need,
as you mentioned, the limited range of
motion will affect those two movements specifically. So those are the most common symptoms that the patient will come. And also there are a lot of other things that can interfere with the problem itself, such as the shoulder instability. So it's
Shoulder instability.
instability. People
Like
will
someone is walking and you feel the shoulder is walking alone. let's say.
yeah, and or sometimes you hear clacks and you hear clicks while moving the shoulder.
Like
So-
the clicks we can hear on the knee joint.
yeah, similar to that. Similar to
Similar.
that. So I think those things are the most common, and we listen to the patient. When the patient talk, we listen to them and we understand and analyze what is going on so that we can have a proper diagnosis and a proper treatment plan for his recovery. Yeah.
That's actually really remarkable. There are some of the questions left I wanted to ask you about, doctor.
Sure.
I'm so glad for the information that you gave us.
Sure.
But of course, we have this short break.
Of course.
So for your viewers, stay tuned and we'll be right back after this short break. Welcome back, our viewers, as we coming back from the short break, continuing the physiotherapy segment, me and Dr. Jawad. So, doctor, continuing on the topic that we're having for today, which is the rotator cuff injuries. Before we finish, before we went for the break, you told us that about a proper diagnostic, let's say, weighing method is listening to the patient and having more information from them. Can you tell us more about the diagnostic tools or the methods that you're having?
Yeah. In order to better diagnose a patient, you need to have a skill set that you apply, and then should be based on an evidence-based practice. So research and studies and conclusions from the literature, then you
Yes.
can apply. One of the most important diagnostic tool is asking question and the communication. So even before starting touching the patient, before starting assessing his joint, you need to listen, because words are powerful things to have. They will describe their injury, they will describe their symptom, they will describe their...
So with that, you will have more information. So doctor, a lot of doctors even say, physiotherapists and other doctors, mentioning that it's actually listening to the patient and describing for the patients. Please try to describe, try to open and tell the doctor about the symptoms that you're having, because it will help doctors such as Dr. Jawad to diagnose and maybe to give you the proper treatment that you want. But doctor, what about the X-ray and the MRI? Is it helpful in a point with it?
Yeah, of course. This is the criteria. We see the patient, we assess through the tools and procedures that we have. And then if we are hesitant and we are not sure about the diagnosis, we ask the patient to go and have some images, such as a plain X-ray or in specific cases, MRI images.
Yes.
So those can help us for sure. And
but not as much as listening to the patient.
Of course, because they are adjacent to the session itself. If the physiotherapist couldn't be sure with his diagnosis, and he made everything possible, he asked a lot of questions, he did his physical examination through the physiotherapy test and tools, but he didn't get a clear cut of a diagnosis, then he will, of course, that's a
Check
collaboration.
the X-ray or the
of course.
MRI.
Collaboration and therapeutic alliance matters, because
Yeah.
we need to have a collaboration between all the medical healthcare providers.
Exactly.
The physicians, the physiotherapists, the surgeons, the radiologists. So all of them are immense in terms of the patient as a circle. So we all are around the patient. We help
same
him.
team.
Of course.
The health team, yeah.
So yeah, images and X-rays are helpful in confirming diagnosis and give us an enhancement and knowledge about
Exactly.
his current situation.
Exactly. So, doctor, what about the treatment methods? Because
Yeah.
this is actually the most important part.
Yeah.
Because a lot of people say, okay, I have the symptoms. I know what you're saying. I need the treatment. What about
Yeah.
the treatment method? When it doesn't require surgery, when it does require surgery, a lot of people say, no, it does require an injury, even though their shoulder is actually walking alone,
Yeah.
grabbing the water or
Yeah.
something. Because, you know,
Yeah, the plan of treatment depends on several factors. One of the most important factor is the situation of the patient. If it is, yes, we said it's a rotator cuff, but if it is a severe one or a minimal one, because some people come with unacceptable
Yes.
symptoms and they can adhere the pain, they can live and digest the pain, and they do whatever they want, yes, with pain.
is it
And
okay
other-
maybe with painkillers? Sorry,
Sure,
Dr. Takaya.
sure, they can manage their pain if it is a minimal with painkiller, with
And with resting, it will heal itself?
resting and specific exercise program. But others, no, they come with us with severe pain, they can't sleep, they can't do any daily activity. So those kind of patients, if we think they need a shortcut or they need a surgery to interfere, then we can apply our rules and our mechanisms of treatment after doing the surgical intervention. So
Of course.
it depends on the situation itself. It depends on the objectives of the patient. So
course.
some patient doesn't want to go through that pathway. They need
The surgery. But
yeah.
of course, if they cannot sleep,
Yeah.
how can you treat yourself through physiotherapy? How can you treat yourself through maybe, let's say, painkiller? You cannot use painkiller lots of the times
Yeah.
because it will actually drop off the immune system,
Sure,
immunity
sure.
system for the body. So
Sure.
having the surgeries, sometimes it's really
Yeah.
necessary.
We always appreciate all the pathways and tools we have. We just need to communicate and collaborate with other healthcare providers, and we need to know the current condition of the patient so we can have the best possible decision for the patient. That's what I think is important with every patient. We have all the tools, we have all the network with other healthcare providers, but the main decision should be based on a strategic planning, strategic discussion. Then we make sure it is the best possible solution for the patient, depend on his situation.
Exactly. So, doctor, regarding on elaborating on the rotator cuff injuries, it's actually, let's say, it's spreading into branches. There are the rotating cuff tear, there are rotating cuff, too many,
Exactly.
actually, let's say, parts of
as,
it.
As we said, it's an injury.
Yeah.
And an injury can consist of several few things. For example, sometimes patients come with a muscle tear, and that's also, we call it under the
What's
umbrella.
the most common, doctor?
Most common is muscle tear, because the muscles tend to tear if they are not adequately programmed, if they are overloaded, if they are...
and of course, for the tear, it can be healed with, let's say, without surgeries,
Of
maybe
course.
over time, and not
yeah,
that serious.
one of the most important thing is when you get a muscle injury, then the muscle itself will heal. The muscle itself will go, the body will go through the process of healing, and then you'll create a new muscle fibers. So those kind of processes will help the body itself. And then you interfere as a physiotherapist, you guide that rehab program after the self-body management of the injury.
Exactly.
Then you go and apply specific exercises to strengthening that muscle.
So we don't have it one more time.
Yes.
That's really remarkable,
This is
doctor.
the ultimate aim.
Yeah, exactly. Thank you, doctor, for all of this information that you are giving us. These answers are really remarkable, such as a remarkable character you are, doctor. We are so glad to have you.
My pleasure.
It was our first episode together. How is it? Was it good?
Oh, yeah, it's great. We had fun.
It is really fun, I promise. So, thank you, doctor. Thank you, all the viewers, for watching. We will see you for the next time. And goodbye for now.